Awesome. I think we'll get started. I feel like this is a good amount. Um, awesome. Alejandro, do you want to kick us off?
Sure. So to start off, a STEM and health equity advocate would like to acknowledge that many of us are in the traditional territory of the Mohegan, Mashantucket, Pequot, Eastern Pequot, Skagit, Golden Hill, Pocasset, Nehantic, Quinnipiac, and Algonquin peoples. And we honor and respect the enduring relationship that exists between these peoples and nations in this land.
Awesome. With that, I would like to introduce our guest speaker today, Dr. Patricia Nez Henderson. Thank you for being here today, Patricia. Um, Dr. Patricia Nez Henderson, a citizen of the Navajo Nation, serves as the Vice President for the Black Hills Center for American Indian Health, an American Indian nonprofit health organization located in Rapid City, South Dakota. Dr. Nez Henderson received her Bachelor of Science degree in biochemistry from the University of Arizona and earned her Doctor of Medicine and Master of Public Health degrees at Yale. As an Indigenous scientist, Dr. Nez Henderson is one of the leading authorities on commercial tobacco research in American Indian communities. Her work in this field has effectively focused on incorporating tribal values and customs like living in harmony as it pertains to smoke-free environment and the use of commercial tobacco with more Western knowledge like evidence-based protocols, technology, and general scientific methods. With these unique skill sets, she has demonstrated a record of accomplished and productive research projects. If folks wouldn't mind muting, that'd be wonderful. Thank you. Um, I think I might mute everyone if that's okay. Okay, awesome. Um, Dr. Nez Henderson is a panel member of the 2008 update for the Public Health Service Clinical Practice Guideline, Treating Tobacco Use and Its Dependence, also a panel member of the Federal Drug Administration Tobacco Products Scientific Advisory Committee, and the Human and Health Services Interagency Committee on Smoking and Health. Recently, Dr. Nez Henderson joined the Society for Research in Nicotine and Tobacco Board of Directors. She is the first Indigenous person to be elected as the SRNT president this past year. She and her husband, Dr. Jeffrey Henderson, who also leads the Black Hills Center for American Indian Health with her, who is also an Indigenous physician scientist, have two beautiful children, Thalani and Mato. Patricia, would you like to introduce yourself?
Oh yeah, siya Patricia Nez Henderson da siya dyan sa atin shlong tot sa hiba siya ching change kini da siya nalit ashe da siya che put a sado amado as a inin shla. Thank you, Emma, Alejandro, and everybody that has been involved in this Zoom conference call, or just I guess it's just a way for us to reconnect. For me to reconnect to those that are at Yale. So it's a pleasure. Before I get started, like what Alejandro has done is to acknowledge the lands in which I live, play, and work. These are the ancestral lands of the Oshachi Shakowee, the seven council fires of the Black Hills of South Dakota, or what we know as the Black Hills of South Dakota. The Tribal Alliance, comprised of individual bands of the seven council fires, is based on kinship, location, and dialect. Sante Dakota, Yankton Nakota, and Teton Lakota. I acknowledge the people who reside here for generations. So thank you very much. I'm looking forward to this discussion. I'm not sure. Thank you for the introduction, Emma. And yeah, I'm not sure what else I've been doing. I've lived here in Rapid City area for the last probably 22 years. I always remember that I'm a visitor to these lands because these are the ancestral lands of my husband's tribe, and in doing work here with the Lakota people, I'm constantly reminded that I'm Navajo, I'm Indigenous, but I just have to be very, very respectful of the communities that live here for generations. So thank you.
Wonderful. Okay, thank you. Alejandro, would you like to ask the first question?
Yeah, absolutely. So we just want to know, what was your experience like at a Yale School of Medicine as the first Indigenous graduate? Are there things about your time there that you wish you could change?
That's a very, very important question. And I've been asked that question not only by students, but by my family members. I think I just have to give a little bit of background to how I got to Yale. Right before I think it was the year during my junior and senior year while I was at University of Arizona, I received a document from the federal government. It was a document that said that I needed to relinquish the ties that I had on Navajo Nation forever. So imagine getting this document as an undergrad and having to make some decisions. And years prior to that, over 10,000 Navajos had been forcibly relocated from the ancestral lands in which they live, and it was a dispute over coal mining. A private company had found coal on the lands in which we lived, and then the fight went all the way to the federal courts, and we were asked to move. We weren't asked, we were told to move. So that was hard. I was processing all this as I was applying to med school or School of Public Health, and we're like, do I stay here or what do I do? And retrospectively, I guess what I should have done, had there been a lot more, I guess, education and relocation trauma, is probably stayed and resolved this trauma that I had been going through along with my family and my relatives. But instead I was young and I got accepted to Yale School of Public Health, and I went there. I went to New Haven, and those first 2 years actually it wasn't as bad, because I don't think, I don't know, maybe I just kind of put it aside. I just did my work and got my MPH degree, all while trying to process what had just happened, right? I signed that, I remember the day I signed that document to the federal government, sent it off to them, and forever relinquish the lands on which I grew up, which as an Indigenous woman, as a Navajo woman, that is so important. Your prayers, your dreams, everything is tied to the land. The land is so important. It grounds you spiritually, and so I didn't have that. It just went up in the air. So when I got into medical school, again, I had a choice to either stay in New Haven or go elsewhere, and I decided that Yale was basically the best place for me to get my MD. And I had always envisioned myself being a physician, going back to Navajo Nation and practicing as a physician, because gosh, that's been a childhood dream, right? However, during my probably my first year, yeah, it started immediately. It just the rigors of getting a medical degree education is hard, period, right? So imagine trying to study and tend to your mind, body, spirit, like especially your spirit, my soul. And I tell students that, or I tell people that it was like someone severing my head from my heart. It was probably one of the most excruciating time in my life. And I didn't have Yale didn't have the resource, like saying, hey, Patricia, like, I know you're going through this. Why don't we try this? Or why don't you maybe go home and resolve these issues through ceremonies, through prayer, whatever it is that you need to do. You know, we are there to hope, you know, to help you. That never happened. I didn't tell anybody. I think that was probably the hardest thing. Is it was just I think the only person that really knew what was going on was the Yale's Yale's financial aid director, and a gentleman that had a shop there on Chapel Street. This gentleman was Narragansett and had a beautiful, beautiful store right tucked away. I can remember where it is now. It's just, you know, just right there on Chapel. And it was a store that featured all my relatives' jewelry. So as you see, I love turquoise. Emma knows that. Probably every day I wear different types of turquoise. So a lot of my relatives make beautiful jewelry like this. And I would just go in there and just like feel that energy. And it was, for me, that was so healing, just to sit there and touch the turquoise and think about the lost. And and it was really, really, really hard. But I somehow got through it. Yeah, so I think for individuals, I think now we know a lot more about trauma. We know a lot more about how to effectively treat trauma. But it took me a long time to figure that out, that I really needed to heal from what was taken from me, and create an environment that is healthy, not just for myself, but for my children and their children. Because I started having nightmares actually at Yale, and it just was about this catastrophic events happening to the place where I grew up, this land where I grew up. And with that, whatever tornado or fire or flooding, it was always from the east. And then, according to our Navajo culture, life begins from the east. That's the first thing we do when we awake, is to go run and offer prayers to the east as the sun is coming up. And those dreams continued after my kids were born. And it wasn't until I actually went to Ecuador for a traditional healing conference, where hundreds of psychiatrists actually came to these ancestral lands of the Chequan people, that I was able to figure out that these dreams were related to the relocation trauma. And and that's where my healing began. I think when I was able to make that connection with someone that was there at that conference. And this person continues to work with traumatized communities throughout the world. And when I told her about my dream, she just kind of looked at me. She's like, Patricia, she's like, I'm really curious. Like, were you ever forcibly relocated? And I just like, in tears, crying. She's like, you're having these dreams, and your kids are now part of these dreams. And if you do not do anything about it, they will pick up the energy from you. And you don't want that. So I've made it a commitment in my life, when I found that out, and now, that generational trauma ends with me. Like, I don't want my children to carry that forward. Don't want my grandchildren to carry that forward, because there's so much that my family, my relatives have gone through. We went in 1864 as an example. My great-grandfather, my great-grandmother on both sides of my family went through the Long Walk, where we were in forced encampment for 4 years by the federal government. And I think that's, if you have those traumas throughout your life, I think you become a little bit more sensitive to it now as a scientist. So to answer your question, this is how I am. I love to tell stories and then bring it back. That it was hard. And would I change anything about that situation? No, because it's got me to where I am right now. It's all been a part of my journey. I wouldn't change it. I think the only thing that I would probably change is being more in the present through my trauma, to be fully there at Yale on campus, and to know, like, whoa, like this, like history is being made here. Like, what other Indigenous person is here? There was no other Indigenous person there when I was there. It wasn't until towards the end that a couple of them matriculated. But yeah, I think I would have probably, had I been more present, and I probably it would have been a totally different experience. And I think for a lot of you, I think, you realize that if you're in the health field or interested in going into the health field, trauma does that to you. It just takes you out of the present. And it's something that we're working on with our group here, is to really address that in a manner that will be very helpful for our Indigenous communities.
Patricia, that's a perfect segue. You started introducing a little bit of your work and what you like to do. I'm interested in knowing, what has your experience been like as an Indigenous scientist, specifically in the field of nicotine and tobacco research? And then what do you hope to accomplish as the president-elect for SRNT, as the first Indigenous woman to hold this title?
I think in our Navajo language, or in Navajo culture, we have a word called natpo, natpo, which is the sacred plant, the sacred tobacco plant that we use in our ceremonies. It grows, it's indigenous to the lands there on Navajo Nation. It's a nicotina plant, very tiny. It's not like those big plants that you see the tobacco industry cultivating, very tiny, and it's cultivated. And so that's the background that I come from. My grandfather on both sides, my mom's side and my dad's side, were traditional healers. My grandfather, my paternal grandfather, that's the person that I remember more so than my maternal, because I never met him, but he actually was a traditional healer for animals. So he was like the vet of the community, and people would bring their animals, or he would travel to the communities to help heal these animals, and Zifnatok was always a part of the ceremony. So that's how I grew up. And but the interesting thing though, and I think about this, that he smoked 1 cigarette a day, and Marlboro Reds was his cigarette of choice. And I just remember, like, gosh, this just stinks. But he would smoke it inside his hogan, and once he started smoking, we'd be out of there. Like, we weren't like, nope, this is not. But he's also used ceremonial tobacco, right? So it wasn't until after actually medical school, and by that time I realized, like, I'm not cut out to be a physician. This is not what I want to do. I really, really enjoyed public health, and particularly enjoyed health policy. And so I left New Haven and, in my little car, and drove cross country to make home for the first time in Rapid City, which is where my husband lived at that time. And he was like, yeah, we have this great program. He goes, I went through this great program. You should apply. It really helps. It's an NIH funded project where the goal is to educate individuals that have received, Indigenous peoples who have received PhDs, MDs, JDs, any type of doctoral degree, to go into health related research. And I'm like, I don't know if that's what I want to do. He's like, I think you'd really like it, Patricia. I'm like, and he's like, there's some opportunities for funding for your loan repayment as well. I'm like, oh, so by this time, of course, if you go to med school, you just come away with hundreds and hundreds of thousands of student loans. And mine wasn't that bad, but it was still bad enough. So I applied, got in, and we started getting mentored by these amazing mentors, Indigenous mentors. So this is actually the first time from my college all the way, actually from high school all the way through med school, that I've never had one person that was an Indigenous teacher. So when I entered that 2-year program, postdoctoral program, was the first time I was mentored by Indigenous people. And it was life-changing. It just grounded me where I needed to be grounded. And I knew at that point, like, okay, this is the work that I'm gonna really enjoy this. This is gonna be really awesome. It was very, very difficult, but very, very great training. And they're the ones that said, hey, there's high rates of smoking among Indigenous populations, especially in the Northern Plains. Maybe this is an area you want to consider going into. And I did. And whoa, I mean, that's 22 years later, right? Here I am. And now it's educating. It's my work is about educating people about why we have high rates of smoking among American Indians and Alaska Natives, as well as among the Maori people of New Zealand, as well as the Aboriginals in Australia and the First Nations in Canada. And you go down south to South America, Central America, all these indigenous peoples, they have high rates of smoking. And I think when I first joined the Society for Research in Nicotine, the Society for Research in Nicotine and Tobacco, it's an international organization that really cultivates learning and promotes learning about nicotine, the science of nicotine, right? So I'm listening to these scientists, non-Indigenous scientists, primarily white, and I'm like, they're talking about something that's very sacred to me. Like, that is so interesting. I was like, so I'm looking at their mission statement. It has nothing to say about culture, about sacred tobacco. And so I raised my hand, like we're in a board meeting, it's all membership meeting. And I raised my hand and I asked that question. I was like, I'm looking at your mission statement. And my grandfathers, my family, there's such a strong connection with ceremonial tobacco, but you don't address it. And I think that was my introduction to SRNT, and people are like, oh goodness, who the heck is this woman? And it's continued. I've been a part of this organization for, gosh, I want to say 12 years, maybe longer. And it's just educating. And I think the goal now for me is to decolonize tobacco. Tobacco, the word tobacco is an indigenous word, and the Spaniards in the 1500s took that and ran with it. And of course, we know the history with all the tobacco industries now utilizing, they stole the plant and now they're using it to benefit them. And they've destroyed so many communities, indigenous communities. And I want for people to know that history, that the tobacco industry is a racist organization. They use images of indigenous people throughout the world that are racist. Yeah, and I think there's that connection too with SRNT, that as an organization, we allow them to present their findings, their research findings at this organization's conferences, right? And so it's continued to be, an advocate, an activist, and just letting people know what our story is, what our history is, and for people to realize, like, this is important. And as non-Indigenous peoples, you have a role to listen and to hear our story, why things have happened, and then, yeah, to listen. I think that's probably the main thing. And I'm in my 50s now, and I feel like that's what my role is, and I seem to be doing that a lot lately. And I don't mind kind of getting people upset about it. That's okay. That's their own thing. They have to process that stuff on their own. I'm not there to sugarcoat anything. This is what I've gone through, and this is what my people have gone through, and it's a time for truth. Before reconciliation can happen, truth needs to come out, and this is the truth.
Absolutely. Well, thank you so much. We just also wanted to ask, if a non-Indigenous person or someone on this call listening wants to work with your team or work to help Indigenous populations, what do they need to know or do before engaging with that work?
That's a great question. So if you're Indigenous and you want to work, learn the history. Learn the history and learn what you as a non-Indigenous person need to learn, from us. So as an example, I will share a story, and I haven't shared this in a while. It's about it's about listening. It's about really understanding why things are the way they are. Okay, so I'm going to take you back to your first question, right? Because this really ties into the third question you asked. When I was at Yale, so first of all, I'm a fluent speaker. That's the first, I'm a Navajo fluent speaker. It's the first language I learned. And I think that way when I'm tired, like the Navajo words just come out, and I just feel a lot more comfortable thinking in Navajo and speaking in Navajo when that time permits. So I come to Yale, the first Indigenous woman to come to Yale. And my third year, I was pulled aside by one of my mentors. So this person was very high up in the Yale, I guess the structure. I'm not going to name him out, but he was very well known at Yale in the School of Medicine. And he said to me, he's like, hey, you've done great with your rounds. And I'm like all happy because it was like the end of a 3-month rotation, right? And he goes, I just have one suggestion for you. He goes, your write-ups were great. Your patients loved you, and the residents really enjoyed working with you. However, he goes, there's just something about the way you speak that throw people off. He goes, we can make excuses for people that have come from India and people that have come from Mexico, but there's just something about the way you speak that throw people off. So the next rotation you start, he goes, just let the chief resident know that English is not your primary language. He goes, do you have any questions? I was like, he goes, okay, you're excused. And I left that room, and it was a Friday morning, and I walked into Grand Rounds. I sat down, the room is dark, and all I saw was white men in white jackets. And I just started crying. I left that room, I couldn't stay there, and I went to the Yale's financial aid director, and I just cried and cried. And she's like, Patricia, she's like, when will you, she's like, this is going to happen for a very long time, maybe for the rest of your life, because you're breaking down these barriers, and people just don't know how to interact with you. They don't know how to take you. And so they say these things to you that are very insensitive. And I think for me, though, it was just like, the language is a part of me. It's like, yeah, it's like my organ, right? It's like my eyes, it's like my lungs, it's my heart. The words have energy. The Navajo words are healing, and they're powerful. And for someone to say that to you, it's just like a dagger in your guts, and that's really how I felt. So I think in working with Indigenous populations, it is that we have our language, we have our culture, and it's been totally decolonized in many places. There was over 500 in certain languages before colonization, and now it's just few, and only few can speak the language anymore. The Narragansett, right up the road from you. How many fluent speakers are there? Probably none. The Lakota communities here, I believe they said like 12% of people that are Lakota speak the language fluently. So it's just learning about that history. Why did that happen? And come in with compassion and love, nothing else, no other agenda on your end, and say, okay, let me just listen to their stories. And then it comes out, then your gifts come out, then you're able to provide that, the things that we're needing. We're not going to ask of you of that, but we're going to say, hey, like, like how it happened with Emma. Emma just, she reached out to us and she listened and listened and listened. And yeah, and then all of a sudden, we were able to use her gifts in a really amazing, beautiful way. And when that type of relationship is established, I think that is so cool. And this is an undergrad, right? Like, so, well, she's going to get her master's in public health. And yeah, so all of you that are listening, you have so much to offer us. But I think the first couple of weeks is just listen, just kind of step back and don't say too much, because I think, in my opinion, white people talk a lot. I don't want to generalize it, but they just want their voices to be heard. And then we're like, okay, zip it, don't say anything, just chill. Let us tell us your story, our story, and then we'll invite you in. And I think that works really well for me. So yeah, so that's along, I guess, did I answer your question?
Thank you, Patricia. I told you not to talk about me, but I appreciate you using the example. I have one more question for you, and then we wanted to open this up to a Q&A if folks, specifically students on the call, wanted to ask you questions. But you've recently become more interested in working on Indigenous health issues like trauma and racism, which have been pretty prevalent themes in your thoughts so far. What draws you to these topics, and how do you see them fitting into your research as someone with a nicotine and tobacco background? What do we need to collectively do to address these types of issues?
I think, we have, if you look at all the charts, if you look at data with Indian Health Service or anywhere, American Indian Alaska Natives have the highest this, the highest that. It just goes on, right? The highest rates of diabetes were found, or continue to be found, among our tribal members in southern Arizona. High rates of cancer. And I think it wasn't, and I think as scientists, as public health scientists and interventionists, we often think, okay, if we just lower their A1C by doing X, Y, Z, we'll get to where we are. And the story is, there is a reason why their A1C are high. There's a reason why they're addicted. And more research is coming out about trauma, about how trauma has, just dismantled a person. Look what happened to me, right? Like, yeah, I mean, and imagine collectively if a whole tribe has gone through so much trauma. And then I'll use my tribe, the Navajo Nation. COVID hit us like you cannot believe. We were on the news for months and months and months of having one of the highest rates per capita in the country with COVID infection, and death rate being high. And I was like, this is too much. Like, I can't, we have to address the trauma, like the mind. And I think Navajo people and other Indigenous peoples had it right, and other people too, that the mind, body, spirit is connected. You cannot dismantle the two and just address the physical health or the mental health or the spiritual, emotional. You have to do it collectively. And my communities have done that for generations, centuries, through ceremonies. They were able to do this, and in a very, very effective way. And they continue to do that. But now it's promoting that, I think, for many, many years. The institutions, whether it was the federal government, really got rid of all that. We couldn't even use our own tobacco, natural tobacco, until 1978, I believe. So it was banned for many years, 90-something plus years, that we couldn't practice our ceremonies.
Thank you so much. it was really awesome to hear those answers from you. We'd love to open it up to folks if they have questions, if they want to raise their hand or unmute themselves, or perhaps if they don't want to speak, put it into the chat. But if people have questions for Dr. Nez Henderson, specifically students who are potentially on the pre-health track, we wanted to open the floor to do that now. I'm sure Alejandro and I have a million questions we could ask in response if people can't think of anything, but do folks want to ask any questions?
I can ask a question. Thank you so much for all your answers to your questions and just sharing about your journey through Yale. It's really amazing to hear about. I'm curious a little. So, I mean, I think a lot of what I've been hearing in a lot of the kind of COVID response is about how there were such huge holes in the data that we were able to collect at the beginning of the pandemic about who was being affected, about the ways in which COVID was impacting communities. And being kind of uniquely situated in kind of this Indigenous health space, I'm wondering kind of where you see the biggest holes in data are and kind of where the biggest flaws in our data collection system are that are maybe limiting the work that you're able to do.
That's really an important question. I think data is definitely an issue for many Indigenous communities. The infrastructure is just not there. If you go down to the hospitals as an example, if you just go down a couple miles from here, which is where one of the Indian hospitals is located, you just see it. It's like a building from the 1950s, right? It is so old. So imagine what their data system looks like in gathering data. It definitely, there's definitely some primary issues. Indian Health Service, which has been in existence officially since 1955, has been the key responsible organization to provide healthcare to tribes. And unfortunately, it's very underfunded. And there's a wonderful piece on NPR where they interviewed physicians and scientists about this actually. And they talked about the funding mechanism for Indian Health Service. So that's just Indian Health Service. And I just want to remind folks, like, that's a treaty between the tribes and the federal government. In exchange for all the lands, majority of the lands that we're taking, the federal government had us sign a treaty saying they will provide health care to tribes and tribal communities. Well, that treaty, like it's just pathetic that nothing is being done to really enforce that treaty. And I think that's the truth part of it. And I'm hoping through reconciliation with the federal government that the tribes will begin to share their stories of why there's a lack of data. Why is this happening? And I really believe that it's grounded in racism and in colonization, all mixed together. And we have to talk about that up front, before we can really improve on the structures of things, of data systems, of health. It's health equity and social justice at its core. And COVID just totally exposed that in a worse way. For example, with Navajo Nation, Navajo Nation is like a state, right? It's equivalent to a state, but they're a sovereign nation. They make their own policies, but unfortunately, we still have the federal government kind of overlooking us, making sure that we continue to probably exist for hundreds of years. They tried to get rid of us, but anyway, that's a different story. But the system there just was not ready for COVID. The healthcare systems were not adequate. The tribe just recently formed their Department of Health. So imagine, oh, we're just getting our computer set up and our Excel spreadsheets and all these, softwares that you use to collect data, right? And you're just getting yourself grounded. And then all of a sudden COVID hits and literally nobody was talking to each other because they weren't ready. Indian Health Service, which provides healthcare to Navajo Nation, was not ready to talk to the Department of Health's epi department. And then, yeah, so that took a long time, probably about 6 months to get it into place. And with the help of individuals from different organizations, I know Johns Hopkins had a really big role in this. They were able to really get everything in place for the Department of Health, so that if anything should ever happen like this again in terms of the pandemic, that they will be ready. So yeah, and then that's where I guess for those that are interested, you know, Indian Health Service is a wonderful way to get exposure to health equity issues on tribal lands, tribal communities, volunteering as well. We certainly love to bring on folks like Emma. Emma came on, I know she says, don't talk about me, but she literally just called. She's like, hi, I'm in Yale, and I would love to help. And I'm like, oh my gosh. And she just listened, and here we are. She's published and are beginning to get published. And hopefully that experience is rewarding for her, has been rewarding for her. And it certainly has been for me, just to have somebody that is just true to their values. And yeah, it makes a really wonderful relationship when it comes from the heart.
Oh, geez. Thank you, Dr. We have a question that was submitted anonymously. I'd love to hear what you have to say about this. Someone asked, what advice would you have for pre-health students who are underrepresented in science and health? How can they balance staying in places where they feel most at home while also wanting to break barriers and be that first person?
Oh, surround yourself with mentors that are like you, that share the same values as you. It is so important. Like I said, I didn't, you know, those mentors, there was none at Yale. I think they have the first Indigenous professor. I think he's an assistant or associate professor at the School of Medicine now. So finding that one person makes the biggest difference. And for me, that's one of my joys, is being a mentor, is just cultivating these young Indigenous students to say, hey, like, just, yeah, just come you know, hang out with me for a while. Let's go grab coffee. Or, you know, if they were wanting, a lot of them are needing help with like their professional statements, or their, you know, statements to get into med school or into college. And that's one thing that I love to do. But yeah, identify with individuals that are, if you can just find one, even if it's outside your school, just lean on that person, Zoom them, because it's only, yeah, you just need that encouragement. It is hard being the first at XYZ. Sometimes you're just like, oh, I just can't do this anymore. This is just too hard. Like I cannot do this. And you often get there, and you just kind of have to take time for yourself and say, and reground yourself, go back to where your family is, and take off your shoes. And for me, it's going back to the reservation and, you know, being a res girl again. Tie my hair up in a ponytail and just, you know, being really grounded in the family and the food, and just reconnecting yourself. I think that is so important to your family and your community. If that's probably yeah, and I've done that for myself, and you know, and it's really helped. And I think with technology, we're able to do a lot more of those you know, interconnections that need to happen for students through Zoom, as an example. We're able to have that, to hear your language or whatever that needs to happen to make you feel whole again. So whoever wrote that person, you know, if you're needing some mentorship, reach out to me.
Thank you. I believe Annie Neal's had a question, and if you still have a question, feel free to ask. Otherwise, no worries. We have other questions as well.
Yeah, thank you so much, Emma, and thank you so much, Dr. Henderson, for this wonderful talk. I was so moved by your kind of conversation about thinking about the mind and the body and the spirit as interconnected. And I'm hoping to go into mental health care. And something that I'm really passionate about is kind of thinking about ways that mental health care access can be sort of better integrated in primary care. Um, and I was wondering, sort of also tying into your conversations about trauma and the sort of new research that is continuing to come out about trauma, sort of where you would like to see this sort of maybe connection between mental health care and primary care sort of going, and sort of particularly in relation to Indigenous health outcomes.
That's a really great question. There are many tribal healthcare organizations throughout Indian country now that have incorporated traditional healing into their delivery of care. And I think for traditional healers, that is their expertise, right? Is getting the mind back in alignment with the body and the spirit. That's what they do. They're the first mental health therapists that we've ever had as an Indigenous person. And they're very, very good at that. And there's lots of documentation that points to that. So now the Indian Health Service throughout Indian country, they're beginning to realize that and bringing that concept into healing, so that if you go down to Navajo Nation as an example, you'll see the traditional hospital, and then to the side you'll see a traditional dwelling that is often used by traditional healers called a hogan. And the ceremony, it's dirt floor, and then there's a fire, like a fireplace, a stove. There's like a wood stove that's right in the middle, and that's where they perform their ceremony. So as an example, if a person says, yeah, I really need to talk to a traditional healer, you know, that option is available to them. What COVID has exposed, though, and this is very interesting, and this is something that I've been working on with Navajo Nation, is all that just came to a close. People just did not have access to traditional healers. Like they, everything, we were forbidden to have ceremonies during the first part of the COVID because of COVID. And we're like, how do we, like, then we started thinking and got my team together. It's like, how do we help Navajo Nation to really begin to open up the doors so that the elected leaders can understand the importance of mental health and what is happening to our people for, you know, in terms of mental health. And I said, why can't they get on the airwaves and do Navajo mindfulness, you know, get them centered and say a prayer, just little things like that, right? It hasn't happened, and I get really frustrated, and that's where my activism comes in. I'm like, all right, we got to do something about this. So yeah, it's just a lot of education. I think so many people just don't talk, you know, not just on Navajo Nation, other Indigenous communities, but throughout the world, mental health just has been stigmatized. And I think with a lot of social influencers, including Prince Harry, we're beginning to talk about mental health in a way that's just, it's a part of the language, right? And I'm hoping that we're able to do that with our work. Emma's been very much involved in this project from over the past year, but we've incorporated not mental health, but, well, it is mental health, but Lakota mindfulness into a smoking cessation intervention for women who are current smokers who have experienced intimate partner violence. And we did focus groups and key informant interviews with individuals that, not Native women who have experienced IPV, and they said, we need the prayer, we need the ceremonies, we need XYZ, if you can give this to us. And we're like, okay, it's never been done. Okay, let's do what we can. And we scrapped everything about, tobacco contains over 7,000 chemicals, stop smoking, right? It's not good for you. For going back to the trauma, like not really going into the trauma, but acknowledging the trauma, the historical trauma, and using our gifts as Indigenous people to help them begin to heal. And I think that is, I believe, is the way to do that. We're having conversations about the relocation trauma. No one's ever done an intervention for Navajo families that have gone through that. And I think I'm ready. It's taken me over 20 plus years to get to a really, really good place and to finally begin to talk about it and begin to heal. So yeah, so thank you for bringing that topic up. I think it's really, really critical.
Wonderful. So we're just going to close with one question that was anonymously submitted. And this question was in response to a question that was previously asked about balancing spaces. So someone wanted to know if you could just say a few words about if you have a sense of how things have changed for the spaces for underrepresented folks and how much room there is for us to be ourselves.
I guess where we are right now, we're in a very, very interesting time, a time of healing with our country, right? With everything that is happening with George Floyd and just everything. I think it's allowed things to surface for the first time. People feel safe to us. When I say us, I mean people of color. We feel safe to share, like finally share, like, okay, I've experienced racism, and then when you say that to like a professor, and they're like, what the heck, like, they're shocked by that, many of them, right? Like, and that's what I'm experiencing, and that's what my children are experiencing. Like, they're just like, people are just really, I guess, I don't know, when we're talking about this, Emma and I were talking about white fragility, and when it finally comes up, like that, people of color, especially in academic institutions, when they finally begin to get their voice out like this, I think what really needs to happen is, like I said, is for the institution to just listen. And I'm hoping that that's what Yale is doing. It's certainly, I think my experience was very unique, in that there was no other Indigenous person there. My connection with Indigenous peoples were actually at the undergrad, so I used to go over there and eat fry bread with them and do little cultural stuff and then get back to medical school. But it was very different, and I'm hoping that, yeah, to deconstruct, decolonize these structures that have been placed by academic societies, academic institutions, even the delivery of care of mental health. If you have an Indigenous person there, like, bring on an Indigenous person that will help that person, especially in medical school. Connect them with that right person if that person doesn't know that, if they don't know a traditional healer, as an example. Whoever it is, an elder, there's so much that can be done to support the students so that they can survive this time in their life. And then in return, I think what happens is they will come back to that institution and provide additional guidance. I mean, it doesn't all happen in one time, right? And we're realizing that it's going to take, it's taken how many years? 500 plus years to get to where we are. And it's just going to take, hopefully not that long, but hopefully we can make amends a lot quicker this time around. So I'm very hopeful though.
Awesome. On that note, I think we'll conclude this interview today. Thank you all for being here. Dr. Nez Henderson, thank you for sharing with us, and Alejandra, thank you for co-hosting. I hope everybody learned something today, and I hope everybody has a great rest of their evening. Thank you again.
Yeah,
Dr. Nez
hagona.
Henderson.
Oh, thank you. Bye
Thank
bye.
you all. Take care.
Thank you.
Thank you.